If you or someone you love is facing lung cancer, you may have heard complex medical terms like EGFR mutation, exon 19 deletion, L858R, or exon 20 insertion. These terms can sound confusing, but they are extremely important because they help doctors choose treatments that are more likely to work. Today, we will explain a newly approved treatment called Rybrevant Faspro, what it is, who it is for, why the approval is important, how it works, and what side effects patients and families should understand. Rybrevant Faspro is used to treat non-small cell lung cancer, often called NSCLC. This is the most common type of lung cancer. It includes several subtypes, with adenocarcinoma being the most common. Lung cancer begins when cells in the lungs start growing out of control. Over time, these abnormal cells can form tumors and may spread to other parts of the body. This spread is called metastasis. Smoking is the largest risk factor for lung cancer, but lung cancer can also occur in people who have never smoked. Environmental exposures, secondhand smoke, and radon exposure can also increase risk. In the past, lung cancer treatment relied mainly on surgery, chemotherapy, and radiation. While these treatments are still important, modern cancer care now uses precision medicine. Precision medicine means doctors study the genetic changes inside cancer cells to guide treatment. One of the most important genetic changes in non-small cell lung cancer involves a gene called EGFR, which stands for epidermal growth factor receptor. EGFR helps control how cells grow and divide. When EGFR is altered in certain ways, it can become overactive and push cancer cells to grow uncontrollably. Not all EGFR mutations are the same. The most common EGFR mutations include exon 19 deletions, exon 21, L858R substitutions, exon 20 insertion mutations. The first two types, exon 19 and exon 21 mutations, often respond well to targeted EGFR pill therapies. Exon 20 insertion mutations are different and are usually harder to treat with older EGFR drugs. This makes specialized treatments especially important for people with exon 20 insertions. This is why tumor testing is essential for people diagnosed with advanced non-small cell lung cancer. Knowing the exact mutation helps doctors choose the most appropriate therapy. When people ask for the best treatment for lung cancer, there is no single answer for everyone. The best treatment depends on the stage of the cancer, the genetic makeup of the tumor, whether the cancer has spread, previous treatments and how well they worked, and the patient's overall health. The goal of treatment is to match the therapy to the biology of the cancer while balancing benefits and risks for each individual patient. Rybrevant Faspro is a targeted cancer medicine given as a subcutaneous injection, which means it is injected under the skin by a healthcare professional. It contains two components. The first is Amivantamab, the active cancer-fighting antibody. The second is Hyaluronidase, which helps the medicine spread and absorb properly under the skin. Rybrevant Faspro delivers the same active cancer treatment that was previously given intravenously, but in a different form of administration. Rybrevant Faspro was approved by the FDA for adults with non-small cell lung cancer across the same indications as the intravenous form of Amivantamab. This approval is important because it expands access to a targeted EGFR-directed therapy in a subcutaneous form. For many patients, this can change the treatment experience by offering an alternative to long intravenous infusions. In clinical studies comparing subcutaneous administration with intravenous Amivantamab in combination with lazertinib, administration-related reactions were significantly lower with the subcutaneous form, although injection site reactions were more common. Rybrevant Faspro is approved for adults with locally advanced or metastatic non-small cell lung cancer in specific EGFR mutation settings. It can be used in combination with lazertinib as first-line treatment for patients whose tumors have EGFR exon 19 deletions or exon 21 L858R substitutions. It can also be used in combination with carboplatin and pemetrexed for patients with these same EGFR mutations whose cancer has progressed after EGFR pill therapy. For patients with EGFR exon 20 insertion mutations, Rybrevant Faspro can be used with carboplatin and pemetrexed as first-line treatment. It can also be used alone for patients with EGFR exon 20 insertion mutations, whose cancer has progressed after platinum-based chemotherapy. Amivantamab is a bispecific antibody. This means it targets two important growth pathways on cancer cells, EGFR and MET. These pathways help cancer cells grow, survive, and spread. By binding to EGFR and MET on the surface of cancer cells, Amivantamab interferes with these growth signals and helps reduce cancer cell activity. This dual targeting approach is especially important in EGFR-mutated lung cancer, including mutations that are difficult to treat with older therapies. Rybrevant Faspro is designed to be given under the skin rather than through a vein. The addition of Hyaluronidase allows the medicine to be absorbed properly in this form. In clinical studies, the subcutaneous form showed fewer administration-related reactions compared with the intravenous form in certain treatment combinations. However, injection site reactions can occur, which are expected with under-the-skin injections. This option can improve the treatment experience for some patients and may help clinics manage care more efficiently. Like all cancer therapies, Rybrevant Faspro can cause side effects. Some side effects can be serious and require close medical supervision. One major concern is hypersensitivity and administration-related reactions. These can include shortness of breath, fever, chills, low blood pressure, chest discomfort, and nausea. Most reactions occur during or shortly after the first dose. Patients are monitored during administration, and pre-medications are used to reduce risk. Inflammation of the lungs, also known as interstitial lung disease or pneumonitis, has been reported and can be serious or life-threatening. New or worsening breathing symptoms should be reported immediately. Blood clots, including deep vein thrombosis and pulmonary embolism, are an important risk when Rybrevant Faspro is used in combination with lazertinib. Preventive blood-thinning medication may be recommended during the early months of treatment. Skin and nail reactions are very common. These can include rash, itching, dry skin, infections around the nails, and nail changes. Severe skin reactions have been reported. Sun protection and preventive skincare are often recommended. Eye problems can occur, including dry eyes, redness, blurred vision, and inflammation of the eye. Any new or worsening eye symptoms should be evaluated promptly. Rybrevant Faspro can cause harm to an unborn baby. Effective contraception is recommended during treatment and for a period after the last dose for individuals who can become pregnant. Common side effects reported in studies include rash, nail changes, fatigue, swelling, mouth sores, nausea, diarrhea, and injection site reactions. This approval represents progress in personalized lung cancer care. It reinforces the importance of genetic testing in non-small cell lung cancer and expands how targeted EGFR therapy can be delivered. For patients with EGFR mutations, especially those with harder-to-treat exon 20 insertions, having additional treatment options can make a meaningful difference in care planning. If you or a loved one has non-small cell lung cancer, consider asking your healthcare team whether the tumor has been tested for EGFR mutations, which specific EGFR mutation is present, what treatment options are best for this mutation, what side effects should be monitored, and what preventive measures are needed during treatment. These conversations help patients become active participants in their care. Understanding lung cancer treatment can feel overwhelming, but knowledge empowers better decisions. If you found this explanation helpful, support the mission of Drug Insight Hub. Subscribe to Drug Insight Hub, like this video, and share it with others who may benefit from clear, factual drug education. Drug Insight Hub is dedicated to breaking down complex medical treatments into information the public can understand. Always speak with your oncology team before making any treatment decisions, because your care should be personalized to your specific condition.